Hi, everyone. Good afternoon. I'm Dr. Michael Fox. I'm one of the sports medicine and shoulder surgeons over here at the OrthoVirginia office in Fair Oaks by Fair Oaks Hospital. Today, we are going to be talking about shoulder replacements. That includes primary shoulder replacement, reverse shoulder replacement, and we'll be talking a little bit about new exciting technologies of shoulder replacement that we do here at OrthoVirginia. So excited to talk about this today. So a little bit about me. I am a native of Fairfax, Virginia. I grew up in McLean. I am a product of the Fairfax County Public School System. I did my undergraduate education at Cornell University, and I did my medical school at the University of Virginia. And I went on to the University of Pittsburgh in Pittsburgh, Pennsylvania, where I completed my residency training in orthopedic surgery. After that, I did a subspecialty specialization called a fellowship in sports medicine and shoulder surgery. And that makes me where I was trained to do shoulder replacements, both primary and complex ones. Next slide. Yeah, so I trained in, so if you're a fan of the show The Pit, that takes place in Pittsburgh. So that was basically my life at the University of Pittsburgh, taking care of all sorts of big medical problems over there at the university there. And next slide. While I was at Duke University, I doing my sports medicine fellowship. I took care of the Duke athletic teams, so Duke football, Duke basketball, and which was an excellent experience and a really wonderful athletic program, sports program they have down in Durham at Duke University. Next slide. So there are many common causes for shoulder pain that I see daily in the office. One of the common causes of shoulder pain is arthritis. So what arthritis is wearing out of your joint. So all of our joints are lined with cartilage, and just like on a chicken bone, you notice that at the ends of the chicken bone, there is a shiny surface on there. That is cartilage. So cartilage is really important. It allows our bones to glide nice and smooth. When that wears out, you get rubbing of bone on bone, and that causes a lot of inflammation and pain. Another common cause of shoulder pain is the rotator cuff. So the rotator cuff are the muscles that come from your shoulder blade and they attach to the side of your shoulder. They're very important with powering your shoulder, moving it forward, to the side, behind your back, behind your head. And sometimes those tendons get beat up over time, or you can have an injury and they can get torn, and that can cause pain in your shoulder. And also you can just get inflammation in your shoulder, whether it's tendinitis, which is wear and tear over time of your rotator cuff muscles. There's bursitis, which is inflammation of the fluid sac around your shoulder that is supposed to cushion it, but can get inflamed. And then there's also scarring that can happen as an abnormal response called frozen shoulder, and that can also cause shoulder pain. Those are all things I see very commonly in the office. Next slide. So this is kind of what arthritis looks like. So you can see that around the joint surface there is wearing out of the cartilage, exposing kind of red, angry bone. That causes friction and pain and discomfort. Next slide. This is what arthritis looks like on an x-ray. So you can see normally there's a space in the joint, and that space isn't literally space, it's cartilage. That doesn't show up in an x-ray because it doesn't have minerals in it. But when the cartilage wears out, you get that, like, you lose that joint space, you get bone on bone contact there. Your body starts forming bone spurs as a response to the inflammation, and that's what that looks like on an x-ray. Next slide. Yeah, this is what a rotator cuff tear looks like. So those are the muscles of the rotator cuff coming from your shoulder blade, attaching to the side of your arm there. And when they tear like that, as you can see in that red spot, can cause a lot of pain and weakness. Next slide. So sometimes these kind of can go together. So if you have a rotator cuff that is torn and it's torn for a very long time, the rotator cuff is also important with keeping your shoulder in position. So without the rotator cuff, if it's completely torn, your shoulder kind of tracks incorrectly, and eventually it wears out the socket because of that. So this is what it looks like when you have a bad rotator cuff for a very long time. You can actually end up with arthritis anyway. Next slide. So there's a lot of different ways to help with shoulder pain. And a lot of those don't involve surgery. So in terms of things that can help, physical therapy, building up the muscles of the rotator cuff is very helpful. It allows your shoulder to track better. It helps take away the pain from the tendinitis. And it can be very effective at getting you back to normal function. There's also activity modification, so you can decide to not do the things that cause it to hurt, and that's another way of helping calm your shoulder down. It's not really sustainable in getting you back to the activities that you like to do, but that is an option as well. Anti-inflammatory medication. So this is like medicines in the ibuprofen families, like Advil and things and there's some stronger versions of that as well. Those are very effective at reducing inflammation. There's stuff that you can take by mouth, and they're non-invasive and they help with reducing inflammation in joints. And lastly, the cortisone injection. So cortisone is a very potent anti-inflammatory. This is something that we can inject into the shoulder joint in the office. It works very well at reducing the inflammation from arthritis, but it doesn't take away the arthritis. But it does reduce the symptoms and the pain. So that is something you can do in the office if you have arthritis, or even just rotator cuff inflammation without a tear. That is something that does respond pretty well to a cortisone injection, and usually something we like to try before doing anything invasive. There are other kinds of injections too you may have heard about. In the orthopedic scientific literature, they aren't very well researched in the shoulder. So generally, cortisone is the mainstay of injections. Other injections I tend to be very cautious with and recommending because there isn't a lot of evidence in the orthopedic research community regarding those in the shoulder. In the knee, there is some more evidence, but not so much in the shoulder. Okay, next slide. So, what is a shoulder replacement? So a shoulder replacement is removing the arthritic bone in your shoulder and replacing it with metal and plastic components that articulate and move smoothly and help with the pain. So this is what that looks like. So we remove the diseased ends of the bones, replace it with a metal cap and a plastic component, and those articulate and they move very freely. And that takes away the bone rubbing on the bone, takes away the pain of the arthritis, and allows your shoulder to function better because of taking away that pain. You can go to the next slide. So there are so what that video was demonstrating was a primary shoulder replacement. So primary shoulder replacement is designed to treat arthritis. So this is primary shoulder arthritis. It takes away the diseased bone and replaces it with metal and plastic, just like this. The catch for this surgery is that it requires you to have in order for this to work like a normal shoulder, you have to have a functioning rotator cuff. So if you have problems with your rotator cuff, either, chronic long-term problems or something that's more recent, it may not be the right surgery for you, because without a functional rotator cuff, this will not work correctly, and it will continue to have pain and can even have instability. So usually before getting the surgery, we get an MRI of your shoulder just to make sure that your rotator cuff is functioning correctly. If it is, then you can have the surgery. If it's not, then maybe you're a candidate for a different kind of shoulder replacement. We can go to the next slide. A reverse shoulder replacement is for those other kinds of surgeries. So it is designed to treat shoulder arthritis when the rotator cuff is not functional. It's also designed to treat rotator cuff problems that aren't fixable. So sometimes your rotator cuff is so bad, putting it back together isn't likely to work. So this is an option for those people as well. It again replaces the arthritic bone with metal and plastic. It's a little bit different than a primary shoulder replacement because it's called reverse because we put the ball where the socket was and the socket where the ball was. And we do that because it moves the shoulder joint more out to the side. It allows you to power your shoulder with the big muscle at the side of your shoulder, the deltoid. And that's and that allows you to get motion and strength back in your shoulder. And it also helps with your pain. So it's a very good surgery for people that have arthritis, and have a bad rotator cuff or have a bad rotator cuff problem that's not fixable, or for arthritis that's so bad that it's so worn out that we can't really feel confident that a normal shoulder replacement is going to fix it very well. So that is a good option for those people. Next slide. So there's a lot of new exciting technology in shoulder replacement. So nowadays we can get a CT scan of your shoulder and plan out the surgery before we're even in the room. So we can get a three-dimensional modeling of your shoulder and decide exactly what are the right implants that are best for you, and we can make sure they get in the right spot. So we can design a specific guide, like that little handle you see there, that fits perfectly to the shoulder and allows us to put the implants right in the perfect spot every time, and there's no guesswork. Everything goes exactly where it's supposed to, and that has been very helpful with reducing problems after the surgery. So usually before the surgery, you'll get a CT scan, and that's uploaded to the software, and we plan out all your surgery with that. There are also custom implants that can be designed specifically to fit your shoulder. Those are more important for people that have very, very bad shoulder arthritis that is so worn out that normal components don't work very well. in people that just have normal shoulder arthritis, that's not something that's necessary, but there are custom components that can be like 3D printed just for your shoulder, and that has been shown to be helpful for those very severe cases. There is, down the road, there will be robotics that will also help. You may have heard of robotic hip or knee replacements. That's going to come to the shoulder soon. I think that is always something that's exciting. But this technology that we have right now is also very, very nice to be able to custom 3D print guides that fit perfectly to your shoulder. Next slide. So there's also some other variations of shoulder replacements. There's some alternative surface replacements. These are made of carbon instead of metal. They have been shown to have very low wear rates. And this is a very specific shoulder replacement that's really designed for young people that have, unfortunately, shoulder arthritis early in life. So people in their 30s and 40s that, are a little too young for a shoulder replacement, but are in a lot of pain and need something. This has become a good option for those people because it doesn't have the same wear rates as metal, and it doesn't require a full replacement, just a partial replacement. But it doesn't have the long-term evidence that I would recommend this for everyone. But for people that are a little too young for a shoulder replacement, this is a good option. This is some new technology for that as well. Next slide. And like I had hinted at, so there are robotics that are used for hip and knee replacements that is very effective in reducing malpositioning of the components during surgery. So this technology will be available in the shoulder replacement world very soon, maybe in the next year or so, and it'll probably be something that we use pretty routinely in shoulder replacements. It's not quite released yet, but as soon as it is, I'm sure we'll be incorporating that into our workflow. But as it is, we have some really amazing technology with the 3D printing that really, I think that the jump to this is a small jump, but it's still a nice new technology that'll probably be used very soon. Next slide. So what can you do to get ready for surgery? So in order, this is still, shoulder replacement is an outpatient surgery, so you go home the same day, but it's still a big surgery. So it's important that you meet with your primary care doctor before considering surgery and talking about your chronic medical problems and making sure those are well controlled. You're going to get a CT scan like I talked about, and that's for planning the surgery out before you have it. They'll get some blood work, and that will involve just checking your blood, just to make sure there's no medical abnormalities we would want to know about before taking you for surgery. You also get an EKG to check your heart, make sure, because surgery is pretty stressful on the heart. So you would want to know that your heart is functioning just fine, so to minimize the risks of issues after surgery. Next slide. The day of surgery. This kind of surgery, it can either be done at a surgery center or at a hospital. We prefer to do it at a surgery center. It's nice for you. It's a nice, very easy to navigate space. You get in and out. Very nice. It's a very nice facility. And people usually prefer that experience than going in the hospital with all the chaos of a big hospital building. But we can do it at either setting. We try to do these outpatient, meaning you go home the same day. Sometimes if you have some pretty significant medical problems, sometimes maybe that's not the best choice for you, and it's best to watch it overnight. But for the majority, people are able to go home the same day of the surgery. You will get a nerve block, and that involves the anesthesiologist numbing the nerves in your arm, and that helps with the pain after surgery. And it's something that has been very effective, because usually with this surgery, we don't have to do general anesthesia with a breathing tube. We can do minimal anesthesia, meaning you're out of it, you don't remember the surgery, but you're breathing on your own, and you're getting assistance from the machine, but you're still breathing on your own, and that allows you to wake up much faster from the surgery than the general anesthetic where they put the tube down your throat. So that has been a nice development in shoulder replacement world. And like I said, this is generally an outpatient procedure where we try to get you to go home the same day. It's better not to spend the night in the hospital if you can get a night in your own bed. All right, next slide. So after the surgery, generally, it depends on the kind of shoulder replacement you have. You need to be in a sling for 2 weeks after the surgery, and that you're wearing that pretty much all the time. With a primary shoulder replacement, we take it a little slow in the recovery because we have to repair some muscles that we really want to heal. Like I said, you need a functional rotator cuff after the surgery. So we take it to do well with that replacement. So we take it a little bit slow, but in general, you're in a sling for 2 weeks. Physical therapy does still begin 3 to 5 days after the surgery. And generally that's just light stretching to begin with. And you progress over the next 3 months to doing more resistance type activities, strengthening. And then usually feeling 100% again is more around 5 or 6 months. But You're starting it's a long recovery process, starting 3 to 5 days after surgery, usually going up to about 6 months. Next slide. So how can you set yourself up for success for the surgery? So in general, if you have some medical problems like diabetes, you're going to want to make sure those are well controlled. So it involves talking to and same with your blood pressure and other chronic medical problems like that. You're going to want to make sure those are as optimized as possible before you have this kind of surgery. So meeting with your primary care doctor to discuss that would be helpful. Maintaining a healthy and active lifestyle is always good. Making sure that your muscle strength in your arm is maintained and that you're active and it's good for your cardiovascular fitness. Consulting with the dentist is important after a joint replacement. Bad teeth, like an infected tooth, can potentially put you at risk for infection after a shoulder replacement surgery. And that's it. So if you need any dental work, you might want to have that looked at before considering having surgery. The last thing, avoiding smoking. Smoking is not good for healing. So if you are a smoker, I would strongly consider quitting and not using any nicotine tobacco products if you are considering this kind of surgery, because it just puts you at risk for problems, wound healing, and problems with the tendons healing after surgery. So in general, I recommend people avoiding it. Okay, next slide. All right, that's all I got. Thanks for listening, and I'm going to open it up to questions.
Thank you so much, Dr. Fox. We will be answering questions submitted earlier and questions submitted live. Not all questions will be able to be answered, but we will do as many as we can. If you are watching live, now is the time to put your question in the chat. So the first question that we are going to answer is, how much assistance is needed at home after surgery? Do you need someone to stay overnight? And if so, for how long?
Yeah, great question. So in general, compared to a hip or knee replacement, a little less help because this is your arm. Unfortunately, you don't have to walk on your arm. So in general, people, sometimes it is nice to have someone overnight with you the day of surgery, because you will have some surgery pain and some soreness from that. And sometimes with helping with stuff around the house and stuff like that can be a little bit challenging the first day or so after surgery. But I don't say that everyone absolutely needs to have someone at home for this, because you will be walking and being able to navigate around pretty well. You'll just have to have that sling on. So everything that you're able to do with one arm is fine to do. So generally it's a couple days. It is nice to have someone around if you have someone around, but it's not absolutely necessary.
Thank you. Can you tear a rotator cuff after you've had a shoulder replacement? And if you can, how was it repaired?
Yeah, you definitely can. Generally, if you tear your rotator cuff if you were a candidate for the normal shoulder replacement and you had that done and then the rotator cuff tears, generally that's a problem, because like I said, you need a functional rotator cuff for that shoulder to track well. So if that happens, generally you need to be converted to the other type of shoulder replacement rather than fixing the rotator cuff. There's been a lot of research on that stuff that I've been a part of, and it actually doesn't work very well just putting it back together again. And usually it's better off just switching, it's a more reliable option to just convert you to the other type of shoulder replacement, the reverse shoulder replacement that doesn't require the rotator cuff. That's why we get an MRI before you have the surgery, to make sure that if your rotator cuff is in bad shape, then it's not a good idea for you to have the primary shoulder replacement. You should probably have the reverse shoulder replacement.
Thank you. Should someone do physical therapy before their shoulder replacement?
Yes, generally we do recommend people try physical therapy before having a shoulder replacement, because a lot of times people don't end up needing surgery, and really they just needed some guidance with strengthening up the rotator cuff and allowing their shoulder to track better. And sometimes people never get to the point of needing surgery. So usually I recommend everyone try physical therapy or at least some exercises at home before considering this kind of surgery, which is a major surgery. So it is worth trying all that. Same things with the injections and anti-inflammatory medication. I would recommend trying all those before making the decision to have surgery, because that's a big deal. Yep.
Thank you. Are there any limitations initially or permanently after a shoulder replacement? And we have had all kinds of detailed questions. So people are wanting to know about driving, lifting weights, golf, swimming, tennis or pickleball, Zumba. So just any type of activity you can think of, we've had a question about.
Absolutely. Yep. So There are some limitations both initially and then long term after a shoulder replacement surgery. So initially, like I said, you're in a sling for 2 weeks, so you're not moving. You're only doing a little light stretching for those first 2 weeks, and then afterwards we let you progress a little bit. Usually, it's about 4 weeks of more active focusing on the range of motion, and then it's 6 weeks of focusing more on getting the strength back in the shoulder. So yes, those are the restrictions initially after a shoulder replacement. So the first couple weeks we talk about like no aggressive stretching in the first 2 weeks while things are healing. And this is something that we would go in over a lot of detail if you choose to have this surgery. In the long term, and there are some restrictions with the shoulder replacement it's mainly for things that are not a good idea if you want to have this last the rest of your life, which is always the goal. So the main thing that we're concerned about is heavy lifting. So generally, I tell people that I recommend against lifting above more than anything heavier than 25 pounds with that arm in the long term. So light weightlifting is fine. Heavy weightlifting is generally not advised if you're going to have this kind of surgery because it can lead to the components wearing out faster, and then you might need to have this revised. And that's not a very fun thing to have done. Generally, we would like this to be your only surgery that you need. In terms of going back to sports, golf, pickleball, all those things, yes, those are all fine to do. Generally, the whole reason to have the surgery is we want to get you back to doing the things that you like to do. So generally, there are not any activities that I say people are not supposed to do. High impact stuff with your shoulder is generally not very smart after having a joint replacement either. But very few of my patients are doing like specifically like CrossFit and stuff like that after having a shoulder replacement. So high impact stuff is stuff that we have to discuss, but all lower impact sports like golf, swimming, pickleball, tennis, those are all fine to do.
Thank you. Do you have a normal range of motion after a total replacement or after a reverse replacement?
The goal is to have the most range of motion possible. So after this kind of surgery, usually it's the reason to have the surgery, you either have very bad arthritis or a bad rotator cuff. So both of those affect your motion. The goal is that your motion is improved with this surgery. The expected motion is a little bit higher with the primary shoulder replacement than the reverse shoulder replacement. The goal is always that you get your full motion back. Sometimes it doesn't quite get 100% of your other side, but generally the motion is always improved after the surgery. And the goal, we always want you to get all the way up overhead again. With the reverse replacement, sometimes it's a little bit, it's hard to get the 100% of the motion back. But the goal is that we get your motion back over your head and functional so you can do all of your normal activities again. But it depends a little bit on how bad your arthritis was when you started, how bad your rotator cuff is when you start. And sometimes that can affect the final motion you get. But many patients, I would say the majority of patients do end up with getting excellent motion after the surgery, and that's the goal. The best thing that shoulder replacement is almost always improves is pain. Like it is an extremely effective pain surgery at relieving pain. And then the goal is to get better motion, but sometimes it's not 100% of the other side.
Thank you. Can you have a shoulder replacement if you have osteopenia or osteoporosis?
Absolutely. Yeah. I would say a lot of patients that have this surgery have those conditions, and generally with the shoulder replacement, we don't use cement or anything like that. Even in those conditions, it's been shown to work very well in osteoporotic bone, even with normal shoulder replacement without cement, which is nice. That's not always the case with knee replacements, but with the shoulder, it actually does work very well. So so that's not a concern at all. But it can put you at risk for having, if you were to fall after a shoulder replacement, you can have some problem, and if you were to break around the shoulder replacement, you are more at risk for that, for having osteopenia, but that is not a contraindication to having the surgery.
Thank you. How long do shoulder replacements last?
Yeah, great question. So the truth is we don't know entirely because the shoulder replacements that are around today haven't been around for long enough to know exactly how long they last. But the hope is that they last 20 to 30 years. So that's why we generally say that in terms of having a shoulder replacement, you probably want to wait until you're at least in your 50s, because the goal is for this to last the rest of your life. If it does, sometimes these components do wear over time. Everything wears over time. So if the components do wear, we can always change the components and redo the shoulder replacement. But in general, the goal is that it lasts the rest of your life, and usually the expectation is it lasts somewhere around 20 to 30 years. They may last longer than that, but these haven't been around for 20 to 30 years. This shoulder replacements in general have only been around for 20 years, and the components we have now are much better than what we had 20 years ago. So there's still, we don't quite know the answer, but the hope is that they last at least that long.
Thank you. How do I know when I need a shoulder replacement if I have pain in my shoulder?
Yeah. So, when you aren't able to do the things that you want to do in the day. So if the shoulder pain is waking you up at night, if it's preventing you from doing the activities you want to do, if it's causing you daily pain that limits you in the normal stuff that you need to do to be independent and active, that means that it's probably the time to talk to a doctor and if you end up having, and if the reason for all those things is because you have shoulder arthritis or rotator cuff problems that aren't fixable, then I think that you would probably be a good candidate for shoulder replacement. If it's just a minor inconvenience and it gets better with taking Advil and stuff like that, then probably it's not the time yet for you. But usually these problems do get worse over time, and there may be a time when that is the case.
Thank you. Is there an upper age limit to having a shoulder replacement?
Yeah, age is just a number. So we don't make decisions on we don't have an upper age limit for shoulder replacement surgery. It's more about how well you take care of yourself. So if you are, even if you're in your 80s, late 80s, 90s, but you take care of yourself and you have well-controlled medical problems, then and as long as the testing before surgery shows that that there's not a huge concern for anesthesia complications, then there's not an upper limit for this surgery, and that's why it's just a number, and we treat people based on their physiologic medical problems, and if I think they're a good candidate for the surgery, it's still something that we can do. That being said, generally, when there are patients that have when I'm talking to my patients that are in their late 70s, 80s, and 90s, generally it's a better option to have the reverse shoulder replacement, because when we get to that age, no one's rotator cuff is really doing that well. So generally we like to do the reverse shoulder replacement in that stage. It's a little bit more reliable.
Thank you. How many cortisone injections can someone have?
Yeah. So great question. So there's not really a limit on cortisone injections. The only limit is that we generally say you shouldn't have them more often than 3 months, because that's pretty bad for the bone and the cartilage. There's not really a limit. Many having cortisone injections every 3 months for several years, probably, like I said, probably isn't the best for your cartilage. It might accelerate your arthritis a little bit, but as long as they are effective for you, there's no limit to the number of cortisone injections you can have. Generally, what we find is that those injections are a little less effective over time, and there may become a time when you only get a couple of weeks of relief from the injection, and that's the time to really consider, maybe surgery is a better option for you.
Thank you so much. That is all the time that we have for today. Would you like to close?
Yeah. Thanks, everyone. I hope you learned a lot today. I am always happy to talk with anyone more about this with anyone in the office. I work at the OrthoVirginia Fair Oaks office, right by Innova Fair Oaks Hospital. And I would be happy to see anyone for a consultation and evaluation in the office. And you can both go online, or there's also a phone number you can call to make an appointment.